test, so I'm just going to have her press lightly and resist. Go ahead, Dana, press down. Okay, that works fine. Then I'm going to increase my pressure a little bit and the length of time to test strength. And that tests fine. And finally, I'm going to do the stamina test. I'm going to increase my pressure even more, hold for a longer period of time, like 10 seconds. And that tests perfectly fine. Okay? So that's bilateral neck extensors. I can turn her head this way and check it just on one side. So this will do the right side of her neck extensors. Go ahead and press down. Good. And this will check the left side of her neck extensors. Okay? So we've activated pretty much the muscles in the back of the neck. Now let's see how the ones in the front are doing. Okay? Press up here. That seems to test fine. Press up here. That tests fine. And press up here. What do you feel on that one?
Just that might, under endurance, that might not hold up.
That might not hold up?
Because I felt it kind of go down the side.
Okay. So when you're testing a neck flexor, you see how beautifully the SCMs pop out when I do that test? See how nice that is? She has strength, she has connectivity, but no stamina. Okay? So, and she says she's feeling it in the back of her neck when I'm testing her there. So that's a pretty good indication. If you're testing the front of the neck muscles and they feel it in the back of the neck, that's a good, you know, you have a good idea that something's going on, some relationship is there. Okay? So now let's therapy localize and find something in the back of the neck.
Yep.
There's a spot right here. So I'm at about C4-ish area, right on the neck extensors. I'm going to hold there, pardon me, this way, and let's test again.
Oh,
Yeah.
painful.
But painful, okay? All right. So we know that spot's definitely doing the compensation for the stamina portion of the right SCM, okay? So now we have to release here on the back. Now what would you do? You know, you could release around, you could stretch the neck, you could release here, right? You could do something like this if you're not accustomed to doing body work, all right? But what do you do if you feel there and it feels like that bone's out of place? What do you do? When in doubt, what's the rule?
Refer out.
Refer out. Okay, when in doubt, refer out. So it may actually be that the neck is subluxated at C4, and it may pop in by stretching it and by balancing it, but if it doesn't and it's still a problem, that's a good opportunity to refer out, right?